Welcome to the PSID web tutorial on aging and health content in the PSID. To begin, let's go over what you can expect to learn. This tutorial has 5 parts. We'll start with a general overview of the PSID, followed by an introduction to the unique features of the PSID for studying aging and health-related research questions, a summary of aging, adult health, and wealth-related content in the PSID, instructions for how to review questionnaires from the website, and we'll close with a description of the Medicare or mortality files and the restricted data application process. A separate web tutorial demonstrates how to use the Family Identification Mapping System, or FIMS, to create intergenerational and intragenerational data sets. Begun in 1968, the PSID is the world's longest-running national household panel survey. Although the initial focus of the PSID was on family income, content areas have been expanded over time to include health, wealth, employment, expenditures, education, marriage, childbearing, philanthropy, and other aging-related content. The PSID Data Archive contains data from 1968 through the latest release. The archive has a publicly available web-based interface that allows users to create customized data extracts and codebooks. The unique features of the PSID, including the length of the panel, its genealogical design, broad content, and extensive data archive, make it powerful for studying connections among economic status, health, and well-being across generations and over the life course. Individuals born to the baby boom generation from 1946 to 1964 were ages 4 to 22 when the PSID began. The leading edge of this large cohort began to reach age 65 in 2011. In addition, individuals who were born into PSID families after 1968 have substantial information on their childhood circumstances from their parents' and grandparents' reports. This combination of early childhood experience and adult outcomes represents a major analytical strength of the PSID. The analytical samples are also large. As an example, over 5,500 individuals were between the ages of 40 and 59 as of 2009 and are therefore represented in the data for up to 40 years of their lives. This cohort, born from 1950 to 1968, overlapped substantially with the aging baby boom generation. Starting in the late 1990s, several developments increased the potential of the PSID archive for studying health and aging-related topics. This section provides an overview of health and wealth content, including pensions, in the PSID. Since 1968, the PSID has collected data on work and activity limitations due to physical or mental ill health, health insurance coverage, and tobacco and alcohol use. During the late 1970s and the 1980s, the health content was expanded to include workers' compensation, hospital and nursing care, disability insurance, general health status, and exercise. In the early 1990s, limitations in activities of daily living, ADLs, and instrumental activities of daily living, IADLs, were added. Beginning in 1999, the health module was expanded significantly to include a standard series of questions on health conditions and related expenditures. Health expenditures include out-of-pocket payments for health insurance premiums, nursing home and hospital bills, doctor, outpatient surgery and dental bills, prescriptions, in-home medical care, and special facilities. Retrospective measures of childhood health conditions were added in 2007, and medication use was added in 2011. Finally, detailed information about disability was collected as part of the Supplement on Disability and Use of Time, or DUST. DUST was administered in 2009 on a sample of couples, and again in 2013 on a sample of all adults ages 60 and older. Now let's turn to the collection and expansion of wealth data. The PSID offers 30 years of wealth data. Beginning in 1984, wealth measures, including assets, savings, pension plans, and fringe benefits, have been collected from PSID families. The wealth module was included again in 1989, 1994, 1999, and in every wave since 1999. With over 3 decades of prospective data on wealth, the PSID is especially well suited to study how financial behaviors of the baby boom generation over their life course shaped their economic well-being as they reach retirement age. The PSID is also well suited to study transfers from one generation to the next. In every wave since 1969, Several questions are asked about transfers in the last year to and from family and non-family unit members. In addition, in 1988, the PSID included a more detailed module on transfers of time and money in the prior year. And in 2013, the PSID included a more detailed module to capture both short and long-term transfers of time and money between parents and children. These transfers include information on college expenses and purchasing a home, as well as money and time given and or received in the last year. The transfer information is linked to specific children and parents, many of whom are interviewed in the PSID. To learn more about specific content in a given wave of the PSID, it's important to first review the questionnaires as well as the corresponding user guides.
To find these documents, let's go to the PSID's homepage, psid.org. To find this information, we want to navigate towards the Quick Links section of the homepage, located on the right-hand side of the screen. Click on the link labeled Documentation. This link brings us directly to the page which holds information on the main interview, the disability and use of time supplement mentioned earlier, and other supplemental studies. For example, to review question wording for the Wealth section of the 2011 survey, navigate to the left side of this page and click on the node 2010s, followed by the node 2011, and finally, Questionnaire. This will download the full questionnaire in a searchable PDF format. Open this document and scroll down to the Table of Contents page. You will see that each section of the interview is listed here. Health information can be found in several sections, mainly H, Wealth in Section W, and Pensions in Section P. As an example, use the search function to find Section W, which will bring you directly to the Wealth section. The user guides are updated regularly with the latest information and are located on the same page: Documentation, Questionnaires, and Supporting Documentation.
In addition to the data available in the public release files, the PSID makes available under contract data that requires special protections to ensure that confidentiality is maintained. Here, we provide information on two sets of restricted files, especially relevant for studying health and aging: the PSID's mortality file and the PSID Medicare-linked claims files. The mortality file contains information about the deaths of all individuals in the PSID who are known to have died from the beginning of the study through the most recent wave of data collection. Variables include the year in which PSID staff uncovered death information, the month and year of death, the individual's age at death, the location of their birth and death, and an accuracy indicator of their date of death. The data also include keys that allow users to link the mortality data to the publicly available data. The PSID has also made available nearly 20 years of Medicare claims. Claims data begin with the respondent's first service after Medicare entitlement, which is at age 65 or when qualification for disability insurance is met. Claims files include short-stay inpatient, skilled nursing facilities, hospital outpatient, and physician and supplier. Summary files are compiled annually and by quarter. Researchers who wish to obtain these data must obtain a data user agreement from the Centers for Medicare and Medicaid Services, or CMS, as well as approval from the PSID. For more information on how to apply for CMS and other restricted data, let's begin once again at the PSID's homepage, psid.org.
To begin, click on the Data tab, located at the top of the homepage. From the list of selections, click on the link labeled Restricted Data. This will bring you to the webpage containing links to explanations of the various types of restricted use data, application requirements for those who want to apply for the data, requirements for current contract holders, and frequently asked questions. For the mortality files and other restricted data, not including CMS claims, click on the link labeled Process for Obtaining Restricted Data. Instructions note that in order to apply, you must submit a curriculum vitae, a research plan, a restricted data protection plan, evidence of human subjects review from your institution, and a data request form. Once these documents are accepted, you will then complete a contract for the use of restricted data and submit the administrative fee. At this point, you will receive access to the restricted files via the Virtual Data Enclave. For CMS claims, there are additional requirements. You must be a qualified researcher, such as a faculty member with an active federal grant or researcher linked to a center grant. After you submit materials to the PSID and receive approval, you will also need to obtain approval from CMS. Once you have received CMS approval, you will be provided with claims data and a linking file. If you have any additional questions on how to complete this application process, please see the list of frequently asked questions from the Obtaining the Data link on the Restricted Data webpage.
This tutorial drew upon information from the following articles. This web tutorial was produced by Nora Insalera and Vicki Friedman with funding from the National Institute on Aging. This ends the web tutorial on aging and health content in the PSID. Comments and questions may be sent to psidhelp@umich.edu.